International Volunteering discusses health majors and service learning opportunities abroad. My name is Sudi Nalo, and we also have with us here Megan Hotchkiss.
Hi.
And we are just about ready to get started, but we want to make sure that the sound and visual is working for everyone. There is a chat option that is available in the webinar. So if everyone wouldn't mind typing in if you can hear us okay, or if you can't hear us so that we can correct it. We'll also try to put in the chat box a question as to whether or not you can hear us. So if you can hear us, please type in that you can hear us. Okay. All right. And you can also use the chat option to ask any questions throughout the presentation, and we'd be happy to answer those questions. All right, perfect. So Scott, thanks so much for responding. You can hear us. So we're going to go ahead and get started with the presentation. And again, if you have any questions as we go along, feel free to ask them in the chat box. So we're going to go ahead and pull up the PowerPoint and get started. And we hope that you enjoy the presentation we have prepared for you all today. So to start, we wanted to give you an outline for what we'll talk about today. So today what we're going to look at is we're going to give you an overview, very quick overview of who CCS is and what exactly it is that we do. We'll talk about cross-cultural solutions and the health connection. We'll talk specifically about health placements, and in discussing those health placements, we'll talk about the program model and overview, and we'll also talk about where we are and what health placement opportunities are available today. One quick thing we just wanted to talk about with health placements is we know frequently that colleges and universities are very interested in having their students participate in practical learning opportunities that involve health placements, but you know that there are a lot of health risks that are involved, both in terms of risk management for the university, as well as community expectations in terms of having individuals come in to operate and engage individuals on any health placement levels. And so we definitely want to make sure that we're creating mutually beneficial opportunities that keep in mind the community's best interest and the student's best interest. We don't want to have students in health placement settings without licensures engaging in any unethical practices that may hurt the community members. But we do want the students to have engaging experiences in health placements as well. And so we hope to talk about that a little bit in our healthcare placements. So just to give everyone a general idea of who Cross-Cultural Solutions are, we are a not-for-profit 501c3 that in essence serves as an intermediary organization between our community partners abroad as well as colleges and universities here in the U.S. So we basically work in partnership and in support of students' interests, faculty interests, and staff interests as it relates to health majors. So we definitely want to partner with you, the university, to help address global critical issues. We were founded in 1995, so we have 16 years of international service and service learning experience, and we're very proud of having 30,000 alumni who have participated in our programs, and these alumni are frequently available to share their experiences and best practices from when they participated in CCS programs. And you'll note on this slide that Cross-Cultural Solutions has been highlighted in various news and media outlets. So we know that it's very important for you, the college or university, to have participated in CCS programs that are well noted, well vetted. You want to make sure that the organization has a sound experience and reputation abroad, and we're very proud of that reputation that we have in engaging communities abroad. And so Next, I'll turn it over to Megan to introduce CCS and the Health Connection and kind of what we do and how CCS provides international service learning opportunities, specifically as they relate to health and health majors. So we know that students, faculty, and staff can go abroad and volunteer in different areas, but we want to specifically introduce how does cross-cultural solutions provide health-focused service opportunities abroad. So
thank you, Sudie. And basically what this slide serves is to really show what we call a practical guide to volunteering abroad. I think one of the things we hear on the phone and emails, especially from individual students, is you get an 18-year-old student and the analogy is he wants to go do brain surgery abroad. So one of the things that we really try to do is encourage the student's interest while also setting realistic expectations, again, to maintain those health and safety standards. So CCS actually provides quite a few different meaningful ways that your health major students can volunteer in the health major settings. And one of the ways that we do this is through social and educational influences. And how we take the volunteers is, it's not only in a hospital or clinical setting, but we also address public health issues, and these can be in any of our different types of placements, in schools, in homes for the elderly, in daycare centers. And just to give you an example, so maybe a nutrition major wants to study and really wants to get that hands-on experience. So maybe they're working in a daycare in the lower income areas in Peru, but one of the areas that the health education department at the daycare focuses is the malnutrition of the students. So the placement may be at a daycare, but the project that the student would be working on would be health related. So that's where a lot of our health connection is really getting us into the community, and health is one area that we're serving the needs of. So just some questions that we typically ask the volunteers is, can a child be healthy if they don't have nutritious meals a day? How does social interaction affect the elderly if they're in a country where they don't have, maybe they've been abandoned or the parents are working 12 to 16-hour days? How does that impact their social, mental, physical well-being? How does working in a daycare and teaching students, like I mentioned, have a day-to-day impact of a child's mental and physical development? And can a student or a child with a physical or mental disability, what kind of quality care are they getting if the organization is underfunded and understaffed? So these are just some of the questions that as we're working with your faculty, with your student, with your staff, that we're asking them to really show them that health, it's not just being placed in a hospital, but health is an overall part of the social responsibility programs that CCS faces. So now we're going to go into what types of health majors does CCS work with. So these are some of the majors that we've had students and groups participate in. It's by far not a 100% this only list, but these are typically the majors that fit into the CCS impact areas. So counseling, gerontology, any of the healthcare management information, a lot of the health promotion, health sciences, community health. We do a lot of long-term care, and that can fold in with nutrition, physical therapy, occupational therapy, any of the health or food sciences, and any of your physician's assistant, pre-med, any of those can typically be rolled into a CCS project. So now that we've sort of gone over the overview of what is healthcare, how do health majors relate to volunteering in a CCS health placement, Sudie's going to start taking you through the CCS model, And applying that model, I know some of you have sat in on our webinars before, we're going to connect that model to health majors so that you can then take this back to campus and make it a relevant experience for your stakeholders on campus.
So basically, any students, faculty, or staff members that are interested in gaining practical experience abroad within a health setting can expect through a CCS program to engage in 3 different activities. Those 3 different activities will be the direct volunteer work that you participate in for about 4 to 5 hours in the morning. In the afternoons, you'll participate in cultural and learning activities, which are what we would consider training and development activities that are used to enhance your volunteer work. And so we'll go into detail later on as to what those cultural and learning activities would be for health placement majors. And then you have free time, which is the opportunity to create a not only a engaging experience for the students, but also a fun experience for them. So they may be volunteering, as Megan mentioned, within a healthcare clinic, within a nursing home, within a daycare, within various settings. And the free time is an opportunity for the students to unwind and for them to learn more about the community, for there to be a cultural exchange, for them to be able to travel and explore the community. And so in general, that is the CCS program model, which is a typical day for a volunteer, which again is 4 to 5 hours of volunteering in the morning, 3 to 4 hours of cultural and learning activities in the afternoons, and then free time activities in the evenings and weekends. And so when you have these activities, we come back to this idea of then what is the role of the health student as a volunteer. And one thing that Cross Cultural Solutions really wants to do is to be able to set expectations for what students and faculty can expect to experience in the areas of health placements. Realizing that many of these students may be pre-med majors, biology majors, or nursing majors who have not yet received licensures, they can expect their roles will be observational, and their roles will also be introductory in terms of managing health records, doing general intake and triage activities. The role of the volunteer is not to be a surgeon. It's not to be one who is diagnosing any illnesses. It's also not one that's going to be hands-on in a way that will impact a client or a community member directly. It's going to be indirect support and engagement, and we want to make sure that we, take the time to set realistic expectations. And I'll let Megan add anything to what the role of the volunteer might be. Is there anything else?
I would just say that for our students that taking out the community health aspect and getting more, like Sudie said, the nursing, the physical therapists, the future doctors. One thing great, for example, our site in Guatemala, a lot of the hospitals and community clinics we work with, they don't have segregation in terms of having a child unit, having a gerontological, having a NICU. So one of the great things with the students is they may be doing the introductory volunteer work that Sudie mentioned. However, they're going to get to see on a daily basis maybe a PICU baby, then an adult that has diabetes. So they're going to be getting to see an overall breadth of patient care in the observation mode. So that is something that, while I always liken it kind of like if you're trying to get into med school and they say, oh, go be a candy striper. You're going to be doing the basic entry-level volunteer in a hospital, but while being there and putting yourself immersed in that environment, you're going to get to see more and sort of open your eyes. So that's sort of what we really try to set those expectations to. And as part of the CCS development process, each volunteer completes a skills and interest form, and this is where they can write. For example, we've had students that maybe a third-year pre-med student, but maybe they have their EMT certification outside of school. So this is where if they do have any specialized skills, they can let us know, and then that can be incorporated into the type of placement they have. So really, we put the emphasis a lot on the student or faculty who's developing their course or their program so that we can protect the volunteers, protect the community members that we serve, but also pull out the best skills of the volunteer to make sure they have the most enriching and fulfilling experience that's relevant to their major, while also maybe sharing their skills with the local community. So health is always that slippery slope for us, just because so many of the students are so gung-ho, but we really want to make sure that they're having a safe and educational experience so that then they can take that back and apply that to their majors and their future careers. Thank you, Subi.
Not a problem. And if we have any questions so far, feel free to ask those in the chat window. If you have a question about the role of the volunteer or our program model, we're going to move on and talk about where you can volunteer and what the process is for volunteering. But feel free to ask any questions if you have them so far. So next, we want to talk specifically about the volunteer work. Frequently when you're coordinating these programs, the question is what exactly can we expect to be doing in country as it relates to health and healthcare? So these are a couple of actual activities that volunteers will engage in abroad as it relates to health and healthcare. So you can expect to be caring for elderly persons in a residential day facility. You'll be assisting with physical therapy or persons with disabilities in their activities, helping to prepare healthy meals for children and adults, assisting with infrastructure upkeep within community centers, spending time with doctors and nurses, actually having practical English teaching with doctors. Frequently, you'll have individuals in languages, and it is a barrier in terms of what they're able to do. So some of these activities may involve providing training and development in order to improve healthcare practices. Also helping them to exchange ideas. So talking about different health practices as it relates to maybe a U.S. standard and merging those. Not necessarily imposing them, but merging them. So you'll be learning about health and healthcare practices, and then you will provide general ideas for things that are done in the U.S. in order to improve healthcare service provision. So these are just a couple of the activities that individuals can expect to do while in country. So next, Megan will talk a little bit about where we're located and, what activities individuals can expect to engage in any of the respective CCS programs. And the hope is that as you're thinking about coordinating your program, the next most important thing is to think about where you can actually participate in a CCS program.
Sure. Great, Sudie. So the countries listed here, CCS is in 10 countries. These are countries that have specific healthcare placements and focus centers. All of our countries have some sort of those public community health, but these are the ones that you really see a direct connection. India and Guatemala are two most focused health placements. They both have the health clinics, hospital settings that really give you that pre-nursing, pre-physical therapy, and pre-med placements. Working down the list, Thailand, South Africa, Tanzania, Brazil, and Morocco, they have more of the applied health, public health. For example, Thailand, our country director is a trained nurse. She's worked with the Peace Corps and other agencies within the Bangkok area. So a lot of the placements that she has, she can work with the volunteers, so maybe you're in a school to get that nutrition-based program. In South Africa, we work in the township, so a lot of the issues in the townships have to be focused with HIV and AIDS. So that could then be a community of applied health. In Tanzania, a lot of it is working with elder care and child care, as well as Brazil and Morocco. So it's really taking those major issues and then applying it in the public or community-based health programs. So our next slide is actually going to show you what the different placements are, and this shows you all 10 of the CCS countries. This is something that is also available on our website, And basically on the left, we have our impact areas, and then the top are the different countries. So it's a great visual. Sorry, it's a little busy, but it sort of shows you where the different areas. We divide our placements into impact areas. They're by no means completely black and white. There's a lot of gray area, but it just shows the areas that you can then take and apply back to a student's major if you're an advisor, or if you're working with a faculty member to the learning goals and objectives with their course. So now we're actually going to show you a quick video about the CCS Guatemala program, and it gives you an overview of the whole program site, but at the same time shows a couple of the help highlights.
The cross-cultural solutions volunteers in Guatemala combine diversity. Diversity not only in the workplaces we offer, but in the culture itself.
Guatemala seemed like very unique to go, and I knew nothing about it, so it was kind of an adventure. I thought it was something worthwhile like to do my summer.
The first email that I wrote to my neighbor, I love it. My work placement is to work with elderly ladies in a nursing home. One of the ladies was in crochet. Today, I brought a crochet needle and asked her if she would be willing to show me how to do it. And even though I was very slow, she still was very enthusiastic about helping me through it. And I loved it. I work at the farm for boys 8 or 9 to 18. A lot of them have just been abandoned, some of them are away. And I really hang out with boys and give them hugs and talk to them, even if it's just about a puzzle or a magic trick. They need people to help them do that. People are great, the teachers are very nice, and the food is awesome. I basically feel like I'm coming home to a family, a great community, great combat, and the atmosphere that kind of fuels me for the rest of the day.
For a volunteer coming to Guatemala is not only helping and working, but also having a touch of our culture in their hands.
Today, from Guatemala.
Some of the things they take off this is they're important to the country.
Be a culture and be able to help change the world. I feel like I've gotten a much more authentic exposure to the culture.
Well, that was sort of a day in the life of a CCS volunteer. You got to see a little bit about the home base and the cultural and learning activities. You also got to see 2 different types of placements. You got to see a nursing home and a boys' home / school. And both of these would be areas, the student that was in the nursing home, part of the reason she was crocheting is there's an occupational therapist who works in the location, and they work with the part of the mental planning is to engage the members who live there mentally, physically, by working on their dexterity in their hands and engaging them in conversation. If the CCS volunteers are sometimes the only non-staff interaction that the elders receive. And in the home for the boys, as they said, I believe in the video, some of the boys have been abandoned or run away. So one of the areas they work with is social skills and getting the boys back integrated into mainstream society so that then they can go on to be productive human beings. And that's one of the areas that our staff work. So again, you have your direct health placements for those majors that need the clinics and the hands-on, and then you also have the applied health. So no matter what type of health major your student has or health focus your faculty course has, most CCS placements can then be applied back to their program of study and giving them some practical experience that they can then put on their resume after they graduate as to build them outside of the classroom. So now Sudi is going to talk about some of the next part of the pyramid, the cultural and learning activities.
Yeah, and you'll note from the video that the second half really focused on the activities, whether or not it be making tortillas or learning about cloths and the meaning of different artifacts within the Guatemalan community. And for the very unique thing about the cross-cultural solutions experience as it relates to public health is we allow for the volunteers to directly interact with communities in a healthcare setting, but we also have them to learn about the different cultural nuances or the cultural expectations of a community so that it makes it a lot easier to interact with the community members. If they see that you're making an effort to speak to them in their language, or you dress in their attire, or you eat their food, it makes them more receptive to any of the healthcare practices that you would ask them to do. So again, as Megan mentioned with the video, the young lady that worked in the nursing home, she didn't immediately go in and ask the older lady to do exercises. Instead, she asked her to teach her how to crochet. So learning about the culture of a community and engaging them in activities based on their cultural expectations and cultural practices is something that Cross-Cultural Solutions takes pride in. The cultural and learning activities, again, are the afternoon activities that are trainings within the home base that are fun activities to enhance the volunteer practices that our participants will engage in the mornings. And these cultural and learning activities will range from a mental health speaker coming in, site visits to women's centers, language lessons, and also visits to institutes. And again, these cultural and learning activities provide a more holistic or well-rounded experience for the volunteers. So you're just not volunteering. These activities will then enhance some of the actual hands-on health placements that the volunteers will engage in. These cultural and learning activities are coordinated by our in-country staff members who are local nationals of the community. And these individuals have lived and resided in these respective communities, and they coordinate these activities. So you can expect that many of these cultural and learning activities then will come from the perspective of the local in-country staff members who, again, are from the respective communities. So next we're going to move into, I think I'll quickly talk about free time and then have Megan talk about the program fee and our program fee model for each of these program components that Cross-Cultural Solutions packages for you. So just to finish up, after the cultural and learning activities, Cross-Cultural Solutions allows for free time. These free time activities are coordinated by you, the institution, and these are opportunities for you to kind of customize your program and engage in activities that you are interested in. Some of the free time activities that students have participated in is they will go on field trips to volcanoes, they'll go to the beach, safaris, they'll do hiking, go through rainforests, play soccer with the local communities, visit ruins. And these, again, are activities that you coordinate on your own. So this allows some leadership and partnering with, so that we're not fully coming up with a complete schedule. And many of these free time activities are coordinated in the afternoons and evenings as well as on the weekends. So again, just to quickly recap, Cross-Cultural Solutions does all of the volunteer placement matching. As Megan mentioned, after you complete your skills and interest form, we will match you with an activity. We'll also coordinate the cultural and learning activities, and then we will also provide you with 3 healthy meals a day, all of the in-country ground transportation and logistics. And so now Megan is going to talk a little bit more in detail about the program fee, what that includes, and any details related to cost.
Thank you, Sudie. So as one of my faculty recently said, he goes, I think I'm the subject expert and you guys are the logistical service learning volunteer people. And I thought that was not the most eloquent, but described very well what CCS does. We try to pride ourselves on the fact that we're a semi-customized program. We basically say, you the faculty, you the student, you know what your majors need, you know what your guidelines are for your accreditation, your areas of focus, your courses, and we're the experts in working with the local community and finding out what their needs are, and then CCS serves as the bridge to serve both constituents. You, the academic institution, through your faculty, staff, and students, and the in-country local partners to make sure that we're meeting their needs and not imposing our ideas on them. So CCS serves as the bridge, and as Susie mentioned, we are a 501c3 nonprofit organization. All of our programs are completely funded by volunteer program fees. We do not receive any governmental funding, so we're not getting funded through U.S. tax dollars. Because we are the 501c3, all of our program fees are tax deductible. This is a great complement to any, with the economic climate as it is today, a lot of our students fundraise at least 50% of their program fees so they could get that housing, meal, so if your financial aid isn't covering any or all of it. As part of that program fee, you're getting your housing and meals, as Sudie mentioned. You're also getting full pre-departure assistance with us working with you to develop your course. Our program site specialists are our resident experts in different countries. So say like you're going to Thailand, Sudie and I would help you get your course in your service learning area planned. Once you are enrolled, our Thailand country expert, Katie, who we call the program site specialist, would work with all of your pre-departure assistance. So she would help you figure out that all of your forms, all of your medical, getting all of your arrival, logistics, everything planned. Part of that, you'd get a handbook. We also have our own internal social network called MyCCS, which that serves as our fundraising platform. We'll do your placement, all of your planned cultural and learning activities. Again, you get 3 meals a day, 7 days a week with unlimited bottled water, all in-country transportation. So your airport, to and from the airport, and also anything that's planned on the CCS activity. So anything that's on your official CCS schedule, we will transport you to. We also have medical, health, emergency evacuation, and repatriation of remains insurance. And we have a 24-hour hotline. So if anything were to happen, say when the floods happened in Thailand last year, your volunteers, your university could call in and get live 24/7 updates. And again, this really removes a lot of the logistical planning so that your faculty and staff can really concentrate on the academic highlights, and we can really relieve some of the burden, especially if your office may not have the logistical support if you're a single-person office to plan. Now I'm going to give it over to Sudie to talk a little bit about health and safety. CCS, we are on a special consultative status with the United Nations, and we also are a health and safety advisor to the Peace Corps. So our director of safety and programs, this is one of her passions, is that we do have such a great record in health and safety.
Yeah, and I think that pretty much sums up the safety and security options that are available for CCS. As Megan mentioned, part of the program fee covers comprehensive travel medical insurance, as well as our consultative statuses within respective departments. But one thing to keep in mind is that the cross-cultural solutions model, for every component that we've mentioned during the presentation today, it all relates back to safety and security. For the number one most important piece, it is the volunteer placement and the activity. So we have health-focused students that are volunteering abroad, and we know that this would incline itself to exposure of different health-related issues, and so we want to make sure that the volunteers are going to be safe and secure in their health placement settings. Cross-cultural solutions for any clinic, hospital, or daycare does an extensive vetting of the actual facilities to make sure that our volunteers will not be exposed to any detrimental health practices or diseases within any given country. We also make sure that our volunteers are in sound health conditions to interact with communities. So we do both a health advisory review of volunteers before they go in country, and we do an extensive vetting of our placement sites to make sure that our volunteers aren't exposed to any issues that would pose a risk to them or the community members. So our safety and security were able to share detailed information as the students or faculty members or you, the administrators, would be considering. We would be able to answer any questions from your advisory council as they're reviewing participation. We're able to provide documentation for our insurance coverage, and we're able to share what our evacuation policies and practices may be in terms of what one can expect if there is any health or safety risk that would be involved. As the safety and security slide notes, our home base where the volunteers are located is located in a middle-class gated community with a security guard to provide a safe living conditions for volunteers while they're in country. As Megan mentioned, 3 meals a day are included in the program fee. Those 3 meals are prepared by CCS staff members, and they are local cuisine. So again, they allow for the volunteers to have that fun experience and to really engage in the community and to get a taste of the community, but in a very safe way. Again, our in-country staff are all local nationals to the community, and as part of the program fee, this provides livable wages for our in-country staff members that will be supporting the students in-country. And these staff members all have 10 to 20 years of experience in-country, and they know the community very well, and they're able to provide a safe and secure experience for the volunteers in-country. So that's just a general overview of safety and security. If you have any questions related to safety and security, feel free to ask those in the chat box as well. So to conclude, we'll just summarize what the next steps and processes are together. And then if there are any questions that you might have, we'll leave some time for you to ask those. So as part of the process, we would like for you first to confirm what your major or area of focus is. Megan highlighted the different majors we focus on. So is the focus nursing? Is the focus gerontology? Is the focus public health? You complete the skills and interest form and we will match you with those opportunities. You also select the region or country that you'll be located in. The next thing to confirm is time frame. The great thing about cross-cultural solutions and our model is for many of the countries that we operate in, we are there year-round. We have a commitment to the community members to provide ongoing supports in country. So you let us know the time frame you're thinking about. Is this a semester program? Is this a summer program? Is this a J-term program? What is the time frame that you would be interested in going abroad? Also consider budget options. As Megan mentioned, we have program fees that are associated. The program fee covers all of the in-country expenses. These program fees start off for groups at about $1,895, and it depends on how long you want to be in country, and our programs range from 1 week all the way to 12 weeks. Next, you'll contact Megan or myself to discuss your program in more detail, and we'll help to enroll you. And so that's a general overview of what the process is and what you can expect for the pre-departure process. And Megan, is there anything that as part of the next steps schools should be thinking about in country-wise as part of the program process?
I would just say I know some of schools require a site visit, typically a faculty development course. Some schools are great and can get everything pushed through in a year. Some people it takes more like 2 years. We do offer site visits. Our model site visit is your faculty or staff go in and they actually participate in what we call an Insight Abroad. It's a quick 1-week volunteer. The faculty actually does the whole CCS experience, really letting them get that vetting the first hand to really see what we've been talking about. We do realize that not all faculty or staff can take a week-long visit, so we also offer 3-day, 2-night visits where you actually get sort of a quicker glimpse in the CCS home base. So if that's something that you need to do as part of your vetting process, your course development, your alternative break program, let us know. We do have student, staff, and faculty site visit options. Typically, we'll cover all of your costs in country, and you just need to cover the cost of getting to the country and then any spending money. and our in-country directors love to host and really show off the programs that they've worked in partnership with CCS to create. And on top of that, just wanted to mention that this year, typically we have a program-focused country something every year. This year we're actually focusing on our alternative break program. And through August 30th, we actually have a great discounted program fee of $8.95 for your student-led, official, university-recognized alternative break program. So be happy to send any information about the group pricing, promotional alternative break pricing, or the site visits if you want anything offline. And basically that, how Sudie talked about, is we are talking about health majors, so we work with you to confirm the major focus area, pick the country, do the logistics, get you all set up, you go, come back, and have a great time. So we are working on getting these recordings. We've had a little bit of a rebranding, and you'll notice that we've had a new website today. If you go to ccscrossculturalsolutions.org, you'll see our brand new face. So over the next few weeks and pretty much through the beginning of the year, we're going to be launching more updated versions. So we've had a webinar series. I know we've gotten a couple requests to be on our mailing list, which we do update all of you. So we're going to hopefully have all of the CCS webinar, educational webinars online in the next few weeks. And excuse me, feel free to pass them along to any of your staff, students, or faculty that weren't able to make it. And thank you all for celebrating International Education Week with us. So we appreciate everything that all of our partners across the U.S. do. So I don't know if Sudie had anything else to conclude with.
Yeah, the last thing I think that Megan mentioned is to thank you all for being a part of the webinar today and in the partnering piece. And the last thing to highlight is everything that we've discussed today is part and parcel of a partnership opportunity that we're offering to your office or your institution. We would love to enhance any current programming efforts that you have on campus. So we can either offer this opportunity to your individual students for your individual students to pursue, or we would love to offer this as an opportunity to work directly with your offices to enhance an existing program. So again, if you would like to learn more about partnership opportunities with CCS, we would love to talk with you about this partnerships process and the next steps that are available to you as part of the partnership opportunity. So we know that a couple of you have to run, and so we definitely thank you for taking time out of your busy schedules today to be with us. Our contact information is listed here, so feel free to give us a call if you have any questions related to cross-cultural solutions or our programs. So thanks so much again for joining us today, and we will be available again to answer any questions that you have offline about cross-cultural solutions.
Thank you so much, and know a few of you on the call today, so hopefully we'll continue the development process and have a happy Thanksgiving, great end to your IEW. I'm sure you all have lots of stuff going on campus this week. I know Sudie and I remember from our days of working on campuses, so thanks for taking the 45 minutes out to speak with us. And again, we're always here, a phone call or email away. And it's never, I guess my last parting words of wisdom is it's never too early to start planning, even if you're thinking for, say, 2014, 2015. I know we both